So my name is María González. I'm the Director of Communications and Immigrant Health at Healthcare for All. So I'm going to bring it down to the basics. What do we need to tell our community members? What is the most important thing when you guys leave this room? What are the 3 things or 4 things that you guys need to bring with you? One is that the implementation of the rule is after tonight at midnight, which means benefits used before today and applications submitted before today are not subject to the new public charge rule. That's an important one. The second one is most immigrants in Massachusetts should keep their benefits, because most immigrants who are eligible for public benefits are not subject to public charge, and most people who are subject to public charge are eligible for the benefits. The biggest example, and this is something that you guys need to take with you, if you're a green card holder already and you want to apply for citizenship, this does not impact you. If you already have your green card, chances are you're safe. So please do not consider dropping benefits or changing anything, because you're not subject to public charge. Another thing very important is that the use of benefits by family members who are not applying for a green card is not counted towards the rule. And at the end of the day, this is not about benefits. This is about a wealth test. This is about checking the income, the health status, the age, or the other factors that can make it more difficult for a person to apply for a green card. So it really is reducing family-based migration based on the wealth situation, or the lack of these families. And who do we have to send to immigration and public benefits attorneys if they have questions? So to get there, so that we don't send everybody, because we know that there's limited resources, we can ask a few questions. And there's a flyer at the end on the table that the national campaign put together that has this, let me show you. It has this kind of like light system that can help you determine who's totally safe to begin with. So if the person is already a US citizen, that person is safe. If the person already has a green card, for the most part, they're going to be safe. The only thing that we want them to pay attention to is if they leave the country for more than 180 days. Then they should consult with an immigration attorney. But if not, green card holders applying for citizenship are safe, okay? If they have one of the statuses that do not have a public charge status, they're safe, such as humanitarian statuses, refugees, asylees, U visa, P visa, VAWA self-petitioners, people who are applying to renew their TPS or their DACA paperwork, they're safe. And we have many people with temporary protection status in Massachusetts. A lot of Salvadorians, a lot of Haitians specifically. They are safe to keep their status. So these are what we've been using pretty much our helpline. I have my co-workers here from the helpline, Carlos, Zaida, and Denise. They've been fielding a lot of calls on our helpline about which healthcare programs count towards the rule and which ones don't, because of that wrinkle. What is a state-funded Medicaid? I think out of all the calls that we've gotten thus far, we have not encountered anybody with a status that actually allows them to get federal Medicaid, which would be counted towards the rule. So this is how rare it is to find somebody who qualifies for the benefits who's subject to public charge.